Hi, everybody. Welcome, and thank you so much for joining us. I'm Dr. Fiona Danaher. I'm a pediatrician at MGH Chelsea, chair of the MGH Immigrant Health Coalition, and director of the new MGH Center for Immigrant Health. We're really excited today as part of our week-long Migration is Beautiful campaign to have both a message from Congresswoman Ayanna Pressley, who was not able to join us but wanted to share a few words, and then a wonderful presentation by two national experts in immigrant health. So we'll go ahead and share the video from Congresswoman Pressley first, and then we'll make introductions for the next part of the presentation.
We could all be together in person, but I appreciate the opportunity to join you in virtual community. First and foremost, to say thank you. Thank you to the entire MGH community for your tireless dedication, for your innumerable personal sacrifices, for putting yourself in harm's way in order to keep our families and our communities safe during these unprecedented times. Unprecedented certainly seems the word for 2020. An unprecedented public health crisis, which has created unprecedented economic hardship and despair. And on top of that, unprecedented loss of life, 300,000 lives. And that burden has been disproportionately borne by our most marginalized and vulnerable communities. Now, the pandemic has really exposed, it's laid bare and exacerbated longstanding systemic inequities in our society, particularly for our most vulnerable and marginalized Black and Brown, immigrant, and other vulnerable neighbors. And then to be experiencing this unprecedented hurt, which comes at the end of 4 years of hateful rhetoric and even more hateful policies. Policies from this administration which have targeted DACA and TPS holders. They've implemented cruel family separation policies at our borders and in community. They've weaponized ICE to sow fear and distrust and trauma. And to add insult to injury, in that our immigrant and most marginalized communities have been disproportionately impacted by this pandemic. The current administration has insisted that our immigrant neighbors be excluded from all federal COVID relief. But despite this, despite the cruelty of this administration, our immigrant neighbors and communities have stepped up in the face of this pandemic. Many are our essential workers, and they've also stepped up with unprecedented community and compassion for one another. They were the first to mobilize and to serve communities in response to the outbreak of COVID-19, translating resources and other information for community members on where they could get tested for COVID-19 in Chelsea, Haitian restaurants in Mattapan, resourcing supplies to provide folks with free hot meals, and of course, the large number of essential immigrant healthcare workers who have put in more than their fair share of overtime. Many of the nurses, health aides, translators, doctors, and hospital staff who put their lives at risk to ensure our families and our communities are safe during this pandemic have been immigrants. Even when their place in our country has been questioned unfairly, they have always answered the call to service. I have seen up close the love and the pride of our immigrant neighbors, their hard work, their resiliency, and indeed their patriotism. I want to be abundantly clear that we are going to make it through this pandemic thanks to the contributions of immigrants to our country, in particular, their contributions to our healthcare system. And I'm eternally grateful for the sacrifices they've made. As we speak, my progressive colleagues and I are fighting for a COVID relief package that meets this moment, one that includes direct cash relief in the form of reoccurring monthly payments to help families meet their most basic needs, including for our immigrant neighbors in mixed status families. Rent and mortgage cancellation so no one has to worry about losing their home, a nationwide eviction and foreclosure moratorium to keep people safely housed, workplace protections and PPE for those who can't work from home, expanded and extended unemployment assistance, and investments in state and municipal aid, including our public transit systems and our public schools. And of course, advocating that no one be left behind in this relief. And that includes our immigrant neighbors who up until this point have been excluded from all federal relief. The pandemic is certainly not discriminating, even if some communities are disproportionately bearing the hurt more than others. The pandemic is not discriminating. And if everyone is feeling the hurt, then everyone should feel the relief. I've always maintained that the people closest to the pain should be closest to the power. And I continue to be guided by that mantra to practice that. And that's why every day, to my colleagues across the aisle and to anyone who will listen, I'm uplifting the stories of your families, the stories of struggle, of perseverance, of resilience, and of your immense contributions during these unprecedented times. I find hope knowing that we will get to the other side and we'll get there together. Thank you.
And thank you to Congresswoman Presley for taking the time to share her message with us. She represents a number of the communities that MGH serves and has been a tremendous ally to our immigrant patients. With that, I'm really thrilled today to welcome Dr. Lanre Falusi and Dr. Anissa Ibrahim, who are leading national experts in immigrant health. Both serve as members of the Executive Steering Committee for the American Academy of Pediatrics Council on Immigrant, Child, and Family Health. Dr. Falusi is the Medical Director of Advocacy Education at the Child Health Advocacy Institute, Assistant Program Director for the Community Health Track of the Children's National Pediatric Residency, Assistant Professor of Pediatrics at George Washington University School of Medicine and Health Sciences, and an attending physician at the Goldberg Center for Community Pediatric Health. Dr. Ibrahim is an assistant professor at the University of Washington and medical director of the Harborview Medical Center Pediatric Clinic, the same clinic where she received medical care as a child. She's the first refugee to lead such a clinic in the United States, and we're very grateful to both of you for being here today.
Thank you so much for having both Dr. Falusi and I. We're very excited to be here and really discussing a topic that's important to the both of us, both personally and professionally. By sharing my screen. So today we're going to discuss communication strategies to advocate for immigrant children and families. Oops, sorry, just a little bit of a lag. First, I wanted to discuss a little bit about both Dr. Falusi and my experience with communication advocacy in immigrant children and families. As already said, we're both on the executive committee for the American Academy of Pediatrics Council on Immigrant, Child, and Family Health. Dr. Falusi was the most recent past president of the DC chapter of the American Academy of Pediatrics. She's testified both locally and in Congress for immigrant, child, and family health, and has done multimedia interviews on immigrant child health and advocacy. I similarly have had a lot of media training and have interviewed in TV, print, specifically about refugee and immigrant advocacy. And I've personally used my own story as a refugee from Somalia to showcase many of the issues that I talk about. I am proudly the president of the board of directors of the Somalia Health Board, which is a grassroots organization that has been fighting to essentially take on the inequities that cause the disparities in our community and essentially enforcing that health systems work with local ethnic communities. We wanted to acknowledge our friends and colleagues listed here on this slide for their contributions to this presentation, and also the continued learning that they do help us with on an ongoing basis. Here are some learning objectives that we hope that everyone is able to take away from this lecture at the end of the time together. So let's get into this. Okay. So first, I think it's really, really important to know that the public perception of immigration in the United States, even prior to getting to this slide, is really caught in a big us versus them debate. And what I mean us versus them debate is that there is a difference between what experts are saying and trying to explain and what the public is hearing. Now, important issues are being lost in translation because experts have a deep understanding of immigration reform, and what needs to be done to improve the system, while the public does not have a deep understanding. And what's happening is that when the public is left to their own devices, the issue of immigration in and of itself becomes a highly polarized debate. And when that happens, we need to step back and understand as experts the cultural models that are in play. What is happening at the layperson level? What is happening in the public that is leading to these cultural models, which we'll talk about in a little bit? And what are the challenges that we need to overcome in order to move the needle of public perception? Now, over the past few years, as Congresswoman Ayanna Pressley just said, we've had many instances where we have needed to be very loud advocates for children and families in general, immigrant families, both refugees and immigrants, from having to advocate against family separation, to discussing the horrific conditions at the border, to advocating for improved conditions and medical care in detention centers across the United States. Effective communication has needed to be key, because it's not just what you're saying, it's not just the facts that is going to help you get your point across and move the needle on public perception. It's how you are framing the information that you are trying to pass forward. Now, getting back to the swamp. So as mentioned before, there's shared models that the public already has and things that are already in play. And we need to know what these are before we start advocating, because this is what the public is already exposed to, and this is what the public already knows. So this is from the Frameworks Institute, and if you want to know more, I would highly recommend going to the Frameworks Institute site. They have evidence-based, a lot of evidence-based information that shows how to effectively communicate and how you frame all sorts of different topics. But I'm particularly fond of this immigration memo, and it's called Finish the Story on Immigration, and it's their message memo on their website. Now, here are the models that are already in play. First is this them, right? Immigrants as them model, which is something that we have seen on and on over and over again. And what this shows is that the public focuses on immigrants as a threat to the safety, financial security, and culture of America. And when you see immigrants as them, then the next push is essentially saying, we need to ensure that they, because we've otherized immigrants, don't take what is ours. We have made us very separate from them. Similarly, the way that the public views immigration reform is essentially in a negative or pessimistic view. So it focuses on the negative impact of immigration, or fatalism here in this other corner that you see. It talks about an immigration surge, talks about, money talks and politics as usual, the rhetoric that we've seen time and time again over the past couple of years. The black box of immigration, or the cognitive hole, which I think really describes what it is, refers to the lack of understanding of how immigration works, or immigration reform works, by the general public. And this is really, really important, because if you don't understand the benefits of a system, if you don't understand a system, then it's really difficult to understand why people are essentially asking for policy change or reform. Now, on the other side, the immigrants is us narrative, what we essentially know to be true, is that this humanizes immigrants and people just like you and me, and we value their contributions. I will say that this slide does say nation of immigrants, which we know is not true of the United States, because it is essentially not acknowledging that there are Native people, or indigenous people, and there are people who did not come here as immigrants, such as African Americans. But it is essentially saying that immigration is in the fabric of our country, as is the United States. And then pragmatism characterizes essentially how the public perceives how to improve the system. So when pragmatism is in play and you ask someone, what should we do? What policy reform should we do to help undocumented immigrants? Most people will say, do what makes sense. And that is how you can incorporate something like that in saying, okay, well, what makes sense is incorporating immigrants into society and having pathways for citizenship, et cetera. So these models together are essentially the framework, what the Frameworks Institute calls the swamp of immigration. This is what is at play. Anytime that you are talking or advocating for immigration, this is what these are the public perceptions that are already in play. So once you understand these models, that's the first step in effective advocacy. And there are several organizations, such as Frameworks, that are effectively trying to help people like us shape the public discourse on important issues such as immigration. And the most important thing is building a frame essentially that works. So let's talk a little bit about what does it take to have a frame, to build a new frame for public perception. So this is essentially what the Frameworks Institute did, and they looked at, it did research, and it did evidence-based research essentially to build models for effective immigration. And this is what their research consists of. First, it's expert interviews, talking to people who have a deep understanding of immigration reform and saying what needs to be communicated. Then it's doing cognitive interviews, members of the public, and essentially trying to figure out how is the public thinking about what the issue at play is. Now, I just told you about the swamp, which is what we know, the lay of the land for public perception right now. They also do media content and field frame analysis, and this reviews the advocacy materials that are already in play. And it's important in this, at this point, to really look at both sides, you know, what pro-immigration and anti-immigration, and what is already in play, and what are these different organizations already pushing out to the public. Now, with this information, that's when you move into tool design, effective advocacy design. And tool design looks at what frames are plausible. What are the things that we should be doing? They did on the street interviews, so you know, using these plausible frames and going onto the street and talking to regular people and seeing which frames seem to work. Doing controlled survey experiments, which look at how do we reframe and which frames drive policy, which is going to be important. And then persistent trials, essentially, how are these frames going to fare in the world? Now, for frames that work, effective frames that what we want advocacy to do is shift public thinking and shift the needle of public perception. Now, there are three things that you know, we need in order to consider our frame as effective. That is knowledge, attitude, and policy. All three of these things must be shifted in order for a frame to be effective, and in order for us to feel that we are using effective advocacy in order to change all of these. So let me give you an example. As a pediatrician, we talk about head injuries and bike helmets all the time. So knowledge is essentially trying to push across to the general public that helmets protect children against head injury. That is a fact, right? And but an effective frame also will help change attitudes so that everyone is able to say it's important for all children to wear helmets. And if we're not protecting children from preventable head injuries, then we're not doing a good job as a country. And then the last step is getting policy support. And this is where you do upstream and downstream changes. And that is saying legislation, and that is getting legislation and funds to support pediatric offices to provide free helmets to all children. Now, an effective frame can be used to do all three of these at the same time. So where do we start? I'm going to start by giving a few strategies for effective communication, and then I'll pass it off to Dr. Falusi to take a deeper dive. So number one, when advocating for immigrants at immigration and immigration policy reform, lead with aspirational appeal and shared values. We really have to stay away from painting a dark and gloomy picture, even if that is actually the status quo at the time. Because if we paint a dark and gloomy picture, it's very easy for the public to focus on the negative and say that these problems are too big for any of us to solve. So let's just leave it as is. So leading with positivity and connecting these to shared values, which I'll talk about next, really helps establish why these issues matter and why they're important. Okay, so instead of saying this is not, here are all the negative things that are happening, you lead with something that says this is not who we are as a nation, and this is how we stay true to our values as a nation. So for immigration, here are the three values that the Frameworks Institute has essentially found that really work, and they have been deemed effective for immigration advocacy. So these examples I'll just discuss with regards to immigrant children, but you can actually see how this can be extrapolated to any immigrant population, adults and children and families. So the first value is shared prosperity. Americans care about shared prosperity. So this essentially says that children are the basis of our future, and of our future civic and economic well-being, right? Together we will prosper. Second is the value of human potential, specifically in children and families, saying that we need the talents of children and their skills to be available to our communities, regardless of their immigration background. And then the third value is of human dignity. So saying we have a moral obligation to respect people as people. So let's go through an example. First, so on one side it says, today, 1 in 4 children in the United States is living in an immigrant family. Soon we will see a demographic shift. in which the majority of our children in America are children of color. We must give these children and their families the tools and skills that are needed to help them succeed. So while while this slide essentially does not dwell on negatives, it does highlight a few things that make the argument less effective. First, it focuses on a demographic shift, and you can already see where you will start to lose a part of an audience that is not, that might be afraid of that, or might have, hold some values that are not similar to yours. And it also focuses on words such as give and be, so otherizing the population. So on the other side, we need all children here to reach their full potential if we are going to reach ours as a nation. Much of the country's future success depends on whether we equip children living in immigrant families and their parents with tools and skills that will help them learn, develop, and contribute. We can't afford to wait any longer to figure out how to get this right. 1 in 4 children in the United States lives in a family where at least one parent was born abroad. So this slide essentially focuses on the shared values we have as America, as American people, and where we can be as a nation. So this is an aspirational quote. Second, we need to make immigration an issue of humanitarian concern and pull it away from the divisive rhetoric that it's had recently. And we have to focus on what's on stake if we don't act. So appealing to shared humanity allows us to tip away from this us versus them debate that immigration rhetoric has been caught in for far too long. It is also really important to avoid rights-based language, because what we have seen is when we say immigrants have a right to this or immigrants have a right to that, we essentially are invoking this counter narrative that is already in play, where many people will say, well, these rights should go to law-abiding citizens, or these rights should go to Americans first and not immigrants. So staying away from that is really, really important. And this quote is actually a wonderful example of a moral argument, saying we need to treat everyone with the compassion they deserve as human beings. No matter where they were born, we are all people and are all entitled to the same basic respect. This is a hard argument this is hard to make a counter argument against, because you were essentially saying we have to be moral. And to make it's difficult to make a counter argument against that. And then lastly, we'll say the third strategy, which I think is one of the most important, is pay close attention to the attribution of responsibility. This is really important, especially when we are highlighting disparities, which we often have to do, and inequities, which we often have to do. And attribution of responsibility refers to the framing of who or what causes a problem, who or what is affected, and where the responsibility lies for addressing this. The way we communicate or frame an issue actually creates the attribution of responsibility. And when we discuss issues, specifically those of disparities, we must phrase them in a way that really focuses on the underlying issues and the shared responsibility to fix them. So let's discuss this. So this is one that I had been thinking about a lot when I created these slides, especially with the COVID-19 pandemic, and I hope I hope that it really highlights the attribution of responsibility. So on one side, we have the high number of deaths among Black and written Latinx people in the COVID-19 pandemic can be explained by the higher number of underlying health conditions like obesity and diabetes. So while this statement does not blame an individual, it does leave room for people to blame individuals if they believe that diabetes and obesity are solely the result of only bad dietary choices. So it leaves room for people to blame the responsibility on an entire population if they hold that belief. However, when you use an alternative, like when thinking about the higher number of deaths among Black and Latinx people, we need to think about why people get sick in the first place. Who still has to leave their home to work? Who has to leave a crowded apartment, get on a crowded transport, and go to a crowded workplace? The privilege of continuing to work from home is not available to everyone. So this actually is highlighting the same things, but what it's doing is it's focusing on the social determinants and inequities that have led to these disparities that we are seeing in this pandemic. And last, I just want to say rephrase relentlessly, especially if we want to make sure that we are attributing responsibility to the issues and not allowing space for people and individuals to be blamed. Don't leave room for public imagination to place blame for disparities on the marginalized communities themselves. For example, there are many times when we're talking about, resettling, living in a community where there are immigrants and refugees. And I've seen very highly skilled people say, immigrants are not a burden in the communities that they are settled into. They contribute positively to the economy. Now, because we've used the word burden, that is all people will hear. They will hear immigrant and burden. And so, being careful in words like that is really, really important, because what we're trying to say is immigrants actually contribute positively to the economic growth of the communities that they live in. We have not used the word burden when you say something like that, and therefore the public cannot say immigrant burden. Put those two together. So rephrasing relentlessly is one of the most important things that I can really push when we're talking about immigration advocacy and being effective in the way that we give our pitches to the public. And with that, I'll transition to Dr. Falusi, who'll give us some more examples of effective immigrant communication, and also some common pitfalls to avoid.
Great, thank you so much, Dr. Ibrahim. And thanks to all of you for joining us today and for the invitation to be able to speak with you all about a topic, as you heard, that we are both very passionate about personally and professionally, and could spend all day with you, honestly, but since we only have a short amount of time, we've condensed our slides. So sort of our part two here, I'm going to share some examples of effective messaging and pitfalls to avoid. We'll talk about the "it's not them, it's us" strategy, examples of strength-based language, and then humanizing stories. And these are, again, built off of the Frameworks Institute data, plus some of our own personal experiences. First, starting with the "it's not them, it's us." And actually, sorry, give me one quick second here. So this strategy focuses on the collective orientation, and it moves away from labeling immigrants as other, as you heard about earlier. So rather than otherizing a group of people, it's the collective orientation, the collective prosperity that we focus on. And this is, I think, Dr. Omolara Thomas Uwemedimo, who some of you may know through the American Academy of Pediatrics in particular, she does this very well. As a child of immigrants herself, she does a great job of how immigrants and children in immigrant families contribute to the greater good, and why all people should have equitable access to opportunities and services, such as food access programs. So I encourage you to look up some of her work if you haven't seen that already. Here's an example. So rather than, and I should say too, my assumption, which I hope is the correct one, is that if you are logging into this Zoom, that you probably don't harbor inherently or actively negative viewpoints towards immigrant families, right? But I do know that we have all been acculturated to think about immigration in a certain way. So not to say that I expect that you all would sort of be writing or speaking with the rather than column, but just recognizing again that we are surrounded by messages that aren't always positive. So this is a way that you can sort of help to spin the message and the narrative, regardless of of who your audience is. So rather than talking about things like security or control, let's talk about the value of diversity. Again, the positive spin on things. Rather than talking about immigrants taking jobs, messaging that immigrants are hardworking people. So again, that kind of moral narrative. And rather than they or those people, speaking of we and us as a collective group is how we counteract this us versus them narrative. What about some pitfalls though? So even in, with our best intentions, there are pitfalls that we can fall into. And I know that, myself even, I've fallen into some of these pitfalls. So first we'll talk about the exceptional immigrant. So this is the myth that only certain groups of immigrants deserve to enter into the United States based on their race or their socioeconomic status, proficiency, or their educational status. And I'll read out this quote. It calls out how African immigrants have for some time been described as such, as exceptional immigrants based on educational status. So the paragraph here is quoting another article that was arguing basically for the higher inclusion of people with higher education or English proficiency into the immigrant pool. So first saying, indeed, 41% of African residents in the United States hold bachelor's degrees or higher. Nigerians who've been singled out by the president on previous occasions are among the most educated group in the US, with some 61% holding bachelor's degrees and 7% master's degrees. All this is true, but this rhetoric only serves to boost the myth of merit and further the erroneous belief that only the deserving and exceptional, who are most exceptional because of existing class, family, political, and educational privileges, should be in the United States. So this, I think, personally has really struck me because being Nigerian myself, having been born in Nigeria, coming here as a child, I think this is something that that is spoken of quite often, and certainly any individual or group that has achieved success, however one defines it, should be recognized. But we really need to be careful in our advocacy for immigrant families that we don't overemphasize the need for merit when so many who come into the United States did not have those initial opportunities in their countries of origin, those opportunities for education, for learning English. So keeping in mind, kind of staying away from that exceptional immigrant myth. Secondly, model minority. So this is the perception that certain groups, and this is often used for people of Asian American origin in particular, but the perception that certain groups are more polite or intelligent or successful than the general population, and that they are so because they were able to pull themselves up by their bootstraps, or they may have some kind of innate talent. This sounds very positive, right? But the problem is that this then minimizes the role that racism plays in the persistent struggles of Asian Americans and other racial ethnic groups. It also discounts the experience of individuals and the diversity of cultures, particularly within the Asian American population. As we know, no group is homogenous. But still, like, what is really the harm in this model minority stereotype? The issue is that it places undue pressure on Asian American people. There are studies they may have seen of Asian American college students. They have higher rates of suicide attempts than the average college student. And similar to the exceptional immigrant myth, we should avoid inadvertently putting any group on a pedestal, as that may then disenfranchise others who we're trying to advocate with or advocate for. And then thirdly, Nation of Immigrants, and Dr. Ibrahim mentioned this, we have, again, most of us have been guilty of this. Sometime last year, there was a campaign, the hashtag Nation of Immigrants, or hashtag We Are All Immigrants, which again, the intention is very positive. The intention is to get to that, collective, we, us sort of mentality when it comes to immigration and immigration reform. But the harm here is that this causes now an erasure of Indigenous people, or an erasure of ADOS, so American descendants of slavery. We have attempts at solidarity with immigrant populations, which we should have, but being really careful about some of the wording that we use and ensuring that we aren't then kind of erasing other cultures and other heritage within the United States. So the second example to show you is strength-based language. So this focuses on assets rather than problems or deficits, and recognizes that disparities are based on social and political inequities rather than sort of shifting the blame to individuals. And then the goal here is also to avoid words of oppression. I highly, highly encourage you all to read this article by Natalie Burke on medium.com. It's a short article, How to Fix a Broken Tongue. Actually, Dr. Ibrahim and I got to meet her because she did, I think, 3-part strategic planning session for our Council on Immigrant Child and Family Health. And one of the initial sessions was really about this, sort of how our words can edify or our words can oppress, even if that is not our intention. So she goes through several examples in that article, and a couple of them here. So again, how many times do you see minorities, underserved, vulnerable, at risk, right? We all use those terms to try to describe sort of like the needs of a population. But what that does is that it can leave some of those, leave the populations it focuses on the oppression of them rather than thinking again about a future orientation or more positive orientation. So rather than minorities. So again, very often used term, right? Even I myself am trying to get away from using, but the connotation there is again that you have made a group smaller, right? And also when you think about the global stage, people of color are actually the majority in the world, right? And are not the minorities on the global stage. So other terms to consider, people of color, communities of color, with immigrant families specifically, people in immigrant families, children in immigrant families, or the specific ethnicity or race that you're speaking of. Sometimes we'll say things like people of color have been impacted by the COVID-19 pandemic. That is true. But even more specifically, as Dr. Ibrahim mentioned, Black, Latinx, Indigenous people have been highly impacted. So let's get kind of as granular as you can. The more broad you keep it, like with minorities, for example, you leave it up to people's imagination to fill in the blanks of who it is that you're actually talking about. The term underserved. So a point that Natalie Burke makes in that article is that underserved makes it sound like they are sitting and waiting to be handed something on a silver platter, to be served something on a silver platter, and that all of their challenges relate to services, when in fact the challenges reflect a lack of resources, of which services is only one, right? So, use underserved only when talking about services, such as services around food specifically, but not necessarily as a blanket term for a whole community. And the phrase under-resourced is increasingly being used as a more accurate way to frame those larger issues. For this purpose, resources, when we talk about being under-resourced, means leadership, power, physical assets, money, political will, institutions. Those are the things that are under-resourced in these communities that then leads to disparities and to inequities. And I'll say too, within Children's National, I'm the assistant director for our launch track, which previously stood for leadership and advocacy, the underserved, and community health. And it's really with some of the work through frameworks and with Natalie Burke that the director and I started kind of rethinking that term, and actually changed the title of our whole track. And changed the U from underserved to under-resourced. And then moving away from words like illegal or unauthorized and using terms like undocumented, and you may even see, even sort of more descriptive terms, people without legal documentation or things like that. Vulnerable or at risk, again, sort of puts a label on an entire person or entire population, whereas it's more accurate to talk about what makes them vulnerable. What are they at risk of? So not focusing just on the deficits, but really, as Dr. Ibrahim mentioned, where is the responsibility? Let's be careful about not attributing responsibility for everything to the individual person. So examples could be people experiencing barriers or experiencing discrimination, or people who are experiencing vulnerability because of lack of resources or whatever it may be. What are some pitfalls in this? So our work and our writing about immigrant families should always seek to frame issues with an agency lens, again, rather than depicting people as helpless. And we should always try to maintain the people who are affected as agents in their own story, and not kind of positioning ourselves as saviors for immigrant communities. So this is where the, we want to empower families and communities comes from. Again, who hasn't said the word like we want to empower, right? But what we need to be careful about that is that the connotation is we are the ones bringing the power, and and sharing it or providing it with others, where really we need to acknowledge that individuals and families, they play the most important role in their own journey and advocacy. They may not be literally the legislators or the families that we see in clinic, for example. They're not necessarily in the seats of power on the legislative level, but they do have agency. So let's not take that away from them in our wording. Same thing with giving people or giving communities a seat at the table. They don't really need us to give them a seat at the table, right? Their expertise, their experience is the table of which we speak. And we are guests at that table unless you've gone through the same experiences. And I really love what Congresswoman Presley said in the video clip, and I wrote it down. The people closest to the pain should be closest to the power. So keeping that in mind, even if that's not physically true, and right, even if that ideal is not physically true in the moment, try to think about it in that way, where they have the agency, they bring the experience, they bring the stories, and we are, our role is to help to facilitate sharing that voice, but not necessarily bringing the empowerment as if we are the ones who hold it all. And then finally, humanizing stories. So these provide an emotional appeal, recognizing the unique faces within the immigrant story, also providing the counter narrative for illegal immigration or overuse of social services. You want to, with your advocacy, pair like statistics with these stories to really round it out. And Julie Linton, Dr. Julie Linton, who is the chair of our council and has done a lot of media work on this, I think does this really well as well. This is a quote from one of her interviews where she says, I had a child I took care of in clinic a few months ago who came in complaining of headaches. He said he was told in school that his parents would be sent away, and that's when his headaches started. As a mother myself, I cannot imagine what it would be like to be in a circumstance where I was fearing for the life, health, and education of my child. So talking about a specific patient, talking about sort of what they are experiencing, and which humanizes the issue, and then further adding in her own kind of personal experience, and hoping that both that patient story and her experience reaches the audience in a way that helps to change some of the attitudes. So specific examples here, rather than just stats and facts only, having a detailed personal story, ideally a patient who you saw, and staying away from terms like it's not illegal to, like, it's not illegal to come to the U.S. border and seek asylum. What do people hear? Illegal, right? That's the word that really sticks with you, and you kind of forget the rest of the message there. But rather saying things like, I imagine anyone in that circumstance, anyone who is facing violence and fearing for their child's life, I imagine anyone would come and seek asylum in our nation, or something along those lines. And rather than talking about people as victims, shifting that to talk about them as survivors in their story. So pitfalls here, of course, first with centering your perspective. So, yes, like we should certainly use and mention our pediatrician expertise, but really focus your story on what is most important for that family. And also not asking patients for input. This is something that I've tried to be deliberate in doing over the last couple of years. If I know that I'm doing a media interview or if I'm testifying, and I meet a family who I think, their story really needs to be shared, I have stopped and asked them for permission. If I'm speaking to some decision makers next week, would it be okay with you if I share your story without a name, without any identifiers, if I share your story with them? Now, I've never had a family say no. And then interestingly, also, when I asked, what part of it do you think you really want them to hear? It's not always the part that I thought would be most compelling. And they usually have something even more compelling than what had struck me. So that's something I think can strengthen our advocacy while also being equitable and ensuring that we aren't sort of taking advantage of families and their stories. And then the last pitfall here is having a long story that buries the main point. Mostly important, I think, for media interviews where really they want to get that like 10, 15-second splice. So keeping your story, yes, detailed, but at the same time concise can be a challenge, but something that we should strive to do to make sure that the message gets across. And then finally, some changes that you may want to make in practice. So kind of boiling down everything that the two of us have mentioned. So one, leading your advocacy again with an aspirational appeal and shared values. So with immigration, this is specifically shared prosperity, human potential, human dignity. Secondly, avoiding common pitfalls that elevate certain groups, including ourselves as physician advocates, to the detriment of other groups. And then third, including brief but detailed human stories in your advocacy. So that's sort of our summary of our talk today. And then we do have some references here, and we'll share our slides. And I understand this is being recorded as well. So if you want to do any further reading, there you go. Here. Thank you all for your attention. I think we have time for questions. Is that right?
It's a quiet group, so I will go ahead and start. Do you have advice for people who are new to physician advocacy on where to take these messages to get these stories heard and this information heard?
Yeah, I think we always say advocacy is a team sport. So I think if you think of yourself as an individual, and these are big issues, where do I even start with that? You don't need to start alone. You know, we, both Dr. Ibrahim and I are active in the AAP, and that's always my default to say, get in touch with your AAP chapter. So your local chapter, I think, is a great place to start. More and more chapters have immigrant health committees or special interest groups. So I think getting in touch with them and seeing kind of what their goals are for the year, what are they looking at in terms of advocacy, and where you can be sort of effective and where you can learn and contribute. I know for me personally, that was my experience within the AAP as a resident. I went to the DC AAP chapter meetings and volunteered for like one thing, and the next thing I knew, they had me doing like another thing, and then like running for different like offices and that sort of thing. So I think that's what I would say. Within your institution too, which sometimes I know is tricky. I think our training institutions, our hospitals sometimes are less eager to kind of jump into what could be seen as a divisive or controversial topic. But if you are, if you're motivated enough, that might be a great place to start. And maybe on like your clinic level. So what are your clinic policies, around what happens if ICE comes to your clinic? Some of those, again, still big issues, but looking at it from like your local level in terms of what affects your immediate patients.
Yeah, and I like what Dr. Falusi said. I think the clinic level things are really, really important. And I think that we often forget that unless we have a policy in place, unless it's written down, unless everyone knows that this is what happens, we use our emotional brain when we are fearful, right? So our clinic actually, we put messages up saying like, this is a hospital and we will, we are committed to everyone in plain language and really language that the institution, I kind of did it and I was like, whatever, I'll ask for forgiveness of the University of Washington, but I put it in language where I put it up in a language where if they wanted me to take it down, they would pretty much be saying like, I don't want you to put like immigrants are welcome here, so the way that you do it is very, very important. And I knew at the time that we were putting this message up so that our immigrant communities who were coming to see me in clinic felt safe and they had something there saying that, we stand behind our immigrant families. But I had to be tactical, right? I am a part of a big institution that does not want to take us want to appear political at all. But I put up a message that said, we support all of our patients, regardless of immigration status. And there's no counter argument to that, because that is true to what the hospital is doing. The other thing that I think that you can really find a place of advocacy for is in community organizations. There are tons of community organizations that are working really hard and doing things on a local, regional, and national level. And community organizations were some of the first when, the pandemic relief fund started coming out that said, undocumented immigrants are not a part of this. What are we going to do about it, right? And it was through those organizations that already had hit the ground running, and where you can find time and space to say, here's what I can contribute. How can I be helpful? And more often than not, I find kind of like my energy and become rejuvenated by the work that they are doing, because they don't move as slow as these bigger bureaucratic institutions, but they also give me ideas in which to challenge our institutions. But by saying, here, I went to the community meeting and this is what the community is saying. I went to the community meeting, and in order for them to feel safe, we need to have a policy about how we protect our patients. We need to have a policy about what happens, if ICE does come here. We need to have a policy about, understanding public charge, and we need to, have things in place so the communities feel safe with us, but also feel safe knowing that we're going to give them the most up-to-date information that we have.
Wonderful. Do we have other questions from anyone in the group? You can feel free to put them in the chat if you're afraid to speak up.
Actually, definitely a question, if you can all hear me.
Mm-hmm.
So early on, I think you addressed language for sure as one of the basic foundations in which we either, I guess, empower, but maybe the wrong term, or detract from the power of given groups. It seems that, and when I think about it, a lot of the words we use are inherently already passive, displaced, asylum-seeking, immigrant. Is there a better catch-all umbrella term that is, I guess, being used or adopted or promoted currently to address communities that aren't simply immigrant, but are facing similar barriers?
That's a good question. I think language is very important. I don't think there is a catch-all, but I think there's an importance in fine-tuning the language that you use to specifically talk about different populations. I know, for example, there was many times when, during when we were seeing a lot of children who were crossing the border from the Central American Triangle, people were saying these children are refugees, which to me, absolutely, they are seeking refuge from horrific, from horrific situations at home. They are not just, immigrating for economic relief. They are immigrating because they truly have a fear. And, when you talk about what happens with children, we commonly say children flee, right? They don't just leave their home, they flee it. However, that was actually detrimental to the immigration reform policies that we were trying to do, because they are not refugees, right? There are specific protections that refugees have here. Like, I came here as a refugee. There were specific protections that they have. There are specific services that refugees get. There are specific communities that help refugees. So we were actually doing a disservice for that population by, mixing that term and calling the children who are crossing the border refugees, as opposed to saying they are immigrants who are fleeing horrific conditions. And we need to relate those. We need to make the moral argument. This is a humanitarian concern. This is not a political concern. This is looking at, what would you want us to do if that was your child at the border, right? I can only imagine having a child who, being a mother, having to make that decision, as my mother did, right? But I came here as a refugee, so I had protections when I got here. So I think it's always looking at, do the words that I'm using fit the situation, and what are the barriers that this advocacy has to overcome? What is essentially kind of thinking about, what is the public perception of things first, and then coming. And I think even the AAP really had to think about, fact-based language not really being effective, right? Because if you are just saying facts, then, we're in an era of the internet where people will find their set of facts, so it is saying things like, well, why you might say that if you want to talk about the fact that this child is undocumented, or you're calling them illegal, I'm going to talk about, how would you feel as a parent if you were at the border and, there were, essentially there was a price on your head and you were fleeing gang violence. What would you want the other country to do? And that takes away facts or alternative facts or different facts. It has a humanistic approach to the things, and that's a harder counter argument to make.
I think that's a great answer. I have nothing to add to that. I'll mention, I wasn't sure if the person wanted this to remain anonymous, but someone messaged me a question about how to approach when like a program or institution or group that you're working for wants to interview families who are undocumented, especially if you have concerns around privacy and not perpetuating racism. So I think this is really tough. And so how do you approach that? I would say ensuring that the families first are comfortable with that, or determining if they are comfortable with that. We've had that situation as well in our clinic where, it is a largely, the parents at least, largely immigrant population. Many of them are undocumented. Most of the kids were born here, but we've had, like Washington Post or other journalists contact us saying, oh, do you have patients that we can speak with about the public charge issue or, or other immigration policies. And we've kind of generally said no. I mean, we encourage them if they have their own sort of personal like connections to be able to reach out to individual families, and that's great. But have not been comfortable saying like, sure, here are 3 families to talk with. But at times I have one-on-one with the family asked if they would be willing to speak with a journalist, the day or the next day after we got a request. I rarely have parents say yes to that, I have to say. They'll say yes to maybe one of us kind of helping, working on sharing their story, but are much more hesitant to speaking directly with a journalist, which is completely understandable. So that's how we've approached it. I don't think there's like a blanket like response that works in every situation. But we've sort of taken the approach of, okay, well, let's ask a few families who we think may be interested. And if they say no, then look, we stop asking. We don't want people to feel like they're coming in for their child's health care and then they're kind of being used as, sort of a media story. But again, if it's helpful for us to take their story forward, then we'll ask them about that.
Gracia, are you about to ask a question?
Yes, I'll make a comment.
Go for it.
Hi, thank you so much for presenting to us. I'm Gracia. I'm a primary care pediatrician at one of our healthcare centers. And I think that I really appreciated just learning many ways of reframing things, especially one that I've recently learned is when caring for patients with limited English proficiency, really framing it as I'm the one who needs the interpreter and not that the patient needs an interpreter. And really putting the burden on our end versus putting it on the patient, right? And how we frame things and keeping the positive, maybe Spanish speaking instead of they do not speak English, and really how powerful the wording and how we put things can affect our patients. So thank you so much for sharing this with us.
Thank you.
Yeah. I mean, I think language is it's so important in being able to communicate in a language that someone understands. The only way that you're communicating is if you're communicating in a language that someone understands. So, I think limited English proficiency is even for a long time, people would say non-English speaking, right? We're like, well, coming here. Even my grandmother spoke a few words of English, right? So the fact that it also just otherizes them, right? Like, so here's the English speaking, here's the non-English speaking, without really valuing the number of languages that people do speak. I mean, I've had families apologize for not speaking good English, but that father spoke 5 languages, something that I will probably never be able to do. And he was, literate in 4 of those languages, something that I will never be able to do. And instead of valuing that, he felt ashamed of not being able to speak English. And to me, it was a little heartbreaking when I said, that's not what's important. What's important is that we are communicating in a language that you understand and that I'm able to understand. And I want you to promote your home language to your children and keep that and not try to get rid of that.
Yeah, I think that's a great point. And one acronym that you may see is, I think it's PLOE, P-L-O-E. I may get this wrong, but I think it's, people with languages other than English or something along those lines. So getting away from like the deficit focused, non-English speaking or limited English speaking, when, as Dr. Ibrahim just said, many of those families speak 2 or 3 languages, which is 2 to 3 times more languages than like the average, like the average American, right? So they actually have a lot of skill that they're coming with, but kind of just rewording it to focus on their strength, I think is important. So I think that's an acronym that hopefully we'll see more often.
Wonderful. Well, we've gone past 1 o'clock, so I just want to thank you both so much again for joining us. We've had multiple comments in the chat about how amazing this presentation was, and requests for your slides, requests for the recording. So we do hope that we'll be able to share that with those who are interested. And thank you again. We really appreciate it.